We're now going to discuss part 3 of chapter 7, and this presentation is used with permission from Dr. Kathy Parks, who created it. Epithelial cells are normal components of a urine. Some epithelial cells in urine result from the normal cell turnover of aging cells. They die and they're sloughed off. Others represent damage and sloughing from inflammation or disease. Large numbers of some epithelial cells can indicate an improperly collected urine. Let's say the doctor wanted a clean catch for a potential culture on a sample. Well, if we see a lot of epithelial cells, then that indicates to us that it was not improperly collected, and we may need to order a recollect. Others indicate a severe pathologic process. There are 3 basic types of epithelial cells you need to know and recognize that may be seen in urine: squamous, transitional, and renal tubular. Squamous epithelial cells are the most common and they're largest, and you want to use low power to enumerate them. They line the entire urethra in the female and the distal portion in the males. They're rarely significant, and usually they're from contamination. Transitional epithelial cells, these line the renal calyces, pelvis, ureters, and bladder, and they vary in size due to separate layers. They're often seen in urinary tract infections, after urinary procedures, and carcinoma, and if cancer is present, you may see these in sheets. Renal tubular, each portion of tubule is lined with different types of cells. Convoluted tubular and collecting duct cells are enumerated. These are usually seen in acute ischemic or toxic renal tubular disease from heavy metals or drugs, aminoglycosides, toxicity. The epithelial cells present in the urine may originate from anywhere within the genitourinary tract. The cells may come from the proximal convoluted tubule, the ureters, bladder, urethra, and even the vagina. Normally we see a few in the urine as old cells which are sloughed off. If there's a good size increase in cells, it could be due to inflammation from that particular site along the path. It's hard to differentiate the 3 different types of cells, and some clinical laboratories don't even try to differentiate them. In this slide, you have 2 epithelial cells surrounded by red blood cells. Squamous epithelials line the female urethra and the distal portion of the male urethra. They also line the vagina, and large numbers often represent vaginal or perineal contamination in urine collected from females, or foreskin contamination in urine from males. A few squamous epis are seen in most urine specimens and are useful as a tool to aid in focusing on the urine sediment with the microscope. Their presence has little clinical significance and, as stated, usually represent contamination. These cells are large, they're flat, they're about 30 to 50 microns in diameter with a single distinct nucleus about the size of a lymphocyte or a red blood cell. The cell may be rectangular or round, and the edges may be curled. An important characteristic of a cell that you need to be aware of are called clue cells. And a clue cell is an epithelial cell of vaginal origin that may be seen in urine sediment. Clue cells are usually searched for in wet mounts of vaginal swabs. These cells are epithelial cells that are covered with a coccobacilli known as Gardnerella vaginitis and indicates bacterial vaginosis caused by this bacteria. The bacteria coating the epithelial cell gives the cell a shaggy or bearded cell borders. To be reported as a clue cell, most of the cell surface should be covered with bacteria, and the bacteria should be seen to extend past the cytoplasmic margins. Initially, you would need assistance in classifying cells as clue cells. Transitional epithelial cells form a stratified epithelial lining of the urinary tract from the pelvis of the kidney to the base of the bladder, also called the trigone in females, and the proximal part of the urethra in males. The transitional epithelial cells are 2 to 4 times as large as white blood cells. These cells can be round or pear-shaped and have tail-like projections. The cells may have a distinct centrally located nucleus. They can swell by readily taking on water because they are in direct contact with the urine. You may see them as spherical from swelling like a water balloon. The transitional cells are present in low numbers in a normal urine. Numbers are increased in infections where they are seen together with neutrophils. Clusters or sheets of transitional epis may be seen after catheterization or bladder washings. Renal tubular cells, the nephron from the proximal to the distal convoluted tubules, plus the small and large collecting ducts, are lined with a layer of renal epithelials. Although a few renal epis, also called renal tubular epithelium or RTEs, may be found in normal urine specimens, increased numbers are clinically significant. So as we look at the slide, the shape is dependent upon the origin. They may be flat, cuboidal, or columnar. They're larger than leukocytes, and they contain one large round nucleus. You are not expected to be able to identify or differentiate the different types of tubular cells, but we're going to discuss them just for the purpose of clarification. Distal tubular epithelial cells are smaller, round to oval shaped. They may resemble a white cell or spherical transitional cells. They have a round eccentric, meaning it's not in the middle, nucleus, and granular cytoplasm. Collecting duct epithelial cells are cuboidal only. They have an eccentric nucleus, and sometimes they are seen as large sheets, a renal fragment. And the problem with the distal tubular epithelial cells is they may be confused with white cells, but you need to find a white cell to where you can compare the sizes. Proximal tubular renal epithelial cells are rarely found. They're the largest of the RTEs. They have a round eccentric nucleus and granular cytoplasm. They may look like small casts. Increased numbers of RTEs suggest tubular damage. The damage may be caused by drugs, tubular necrosis, pyelonephritis, or kidney transplant rejection. You may see large numbers in renal disorders, especially acute tubular necrosis and viral infections involving the kidneys. This picture is very interesting because you're able to compare transitional cells to renal epithelial cells to white cells. The letter A is a transitional epithelial cell, the letter B are two renal epithelial cells, and the letter C are a small clump of white blood cells. Here's a list of references if you would like additional information about these topics. Same song, second, third, fourth verse. Please write down any questions you may have after reviewing this information and reviewing your textbook.